Welcome to Nursing Questions and Answers. Let's start. All the following are systems of drains except Option A. Drain by gravity. Option B. Drain under positive pressure. Option C. Drain under negative pressure. Option D. Passive pressure. The correct answer is Option B. Drain under positive pressure. Next question. During laparoscopic surgeries, one of the following gases is used to inflate the abdomen. Option A. Carbon dioxide. Option B. Oxygen. Option C. Nitrogen. Option D. A and B. The correct answer is Option A. Carbon dioxide. Next question. Retraction table is used to position the patient for Option A. Partial hip replacement procedure. Option B. Total hip replacement procedure. Option C. Knee arthroscopy and knee replacement procedures. Option D. Dynamic hip screw procedure. The correct answer is Option B. Total hip replacement procedure. Next question. In the electrosurgical unit, what is the active electrode? Option A. The generator. Option B. The ground pad. Option C. The monopolar handset. Option D. The power source. The correct answer is Option C. The monopolar handset. It is a pencil-like electrode is used to cut the target tissue and coagulated bleeding. Next question. Which is correct regarding the grounding plate? Option A. The plate should be as far as possible to the site where the active electrode will be used. Option B. The plate should be used with a bipolar system. Option C. The plate should be as close as possible to the site where the active electrode will be used. Option D. The patient should be in the desired position after the plate is applied. The correct answer is Option A. The plate should be as far as possible to the site where the active electrode will be used. Next question. Xylocaine 1% with adrenaline can be used for all these operations except Option A. Trigger finger release. Option B. Excision of lipoma in the back. Option C. Knee arthroscopy. Option D. Craniotomy. The correct answer is Option D. Craniotomy. Trigger finger release. It is an open surgery. The surgeon will inject your hand with a local anesthetic. Knee arthroscopy. It is a commonly performed procedure for diagnosing and treating knee joint problems. Excision of lipoma in the back. Lipomas are fatty lumps that develop under your skin. Craniotomy. A part of the skull is temporarily removed. Next question. Dexin suture will be absorbed after Option A. 10 days. Option B. 30 days. Option C. 60 days. Option D. 90 days. The correct answer is Option C. 60 days. Next question. The second counting of instruments and swabs during surgery should be done immediately. Option A. After closing the first layer. Option B. Before closing a cavity in cavity. Option C. After closing the peritoneum. Option D. Before closing the skin. The correct answer is Option B. Before closing a cavity in cavity. Next question. In a knee arthroscopy surgery, the surgeon wants to add 500 microgram of adrenaline in each 1000 milliliters of saline, Stock available of irrigation saline 2000 milliliters per bag and stock available of adrenaline 1 milligram per milliliter. How much ml of adrenaline you will add to each bag? Option A 2 milliliters per bag. Option B 0.5 milliliters per bag. Option C 1 milliliter per bag. Option D 0.1 milliliters per bag. The correct answer is option C 1 milliliter per bag. Next question. A patient has a central venous line inserted in order to monitor their fluid status. A CVP measurement reflects option A cardiac output. Option B pressure in right atrium. Option C pressure in left ventricle. Option D pressure in pulmonary artery. The correct answer is option B pressure in right atrium. CVP stands for central venous pressure. It is the blood pressure in the venae cava near the right atrium. Next question. The nurse should select a suction pressure of not more than to perform tracheostomy sectioning in an adult. Option A 95 mm Hg. Option B 120 mm Hg. Option C 150 mm Hg. Option D 200 mm Hg. The correct answer is option B 120 mm Hg. The pressure setting for tracheal suctioning is 80 to 120 mmHg. Episode of suctioning is completed within 5 to 10 seconds. Next question. A Venturi oxygen mask can be used to deliver oxygen concentration of option A 24%, option B 35%, option C 40%, option D all of the above. The correct answer is option D all of the above. Venturi masks calibrated to deliver fraction of inspired oxygen between 24% and 50%. Most useful patients with COPD. Next question. The nurse cares for a patient being treated for a pneumothorax. The patient has two chest tubes connected to a plurivac drainage system by a Y connector. Which of the following actions should the nurse take before ambulating the patient? Option A clamp the upper chest tube and leave the lower chest tube unclamped. Option B clamp both the upper and lower chest tubes. Option C leave both the upper and lower chest tubes unclamped. Option D clamp the lower chest tube and leave the upper chest tube unclamped. The correct answer is option A clamp the upper chest tube and leave the lower chest tube unclamped. Next question. A nasal cannula is suitable when delivering oxygen therapy of option A 6 to 8 liter per minute. Option B 8 to 11 liter per minute. Option C 1 to 6 liter per minute. Option D 12 to 15 liter per minute. The correct answer is option C 1 to 6 liter per minute. Next question. The nurse should suspect pulmonary embolism if option A. The patient complains of pleuritic pain and dyspnea. Option B. The patient has bradycardia. Option C. The patient has respirations less than 16 per minute. Option D. All of the above. The correct answer is option A. The patient complains of pleuritic pain and dyspnea. Next question. Gowns are considered sterile. Option A. Only from knees to shoulder level front and the sleeves. Option B. Only from the gloves to the shoulder level. Option C. Only from the waist to shoulder level at the front and sleeves. Option D. Only back. The correct answer is Option C. Only from the waist to shoulder level at the front and sleeves. Next question. Which is the correct statement? Option A. If in doubt about the sterility of any item, consider it unsterile except if it is expensive. Option B. The area approximate to 0.5 centimeters around the edges of a sterile field is considered unsterile. Option C. Sterile personnel must be close to the sterile area. Unsterile personnel can be close to the sterile area. Option D. Pouring fluids can be done at the center of the table. The correct answer is Option B. The area approximate to 0.5 centimeters around the edges of a sterile field is considered unsterile. Next question. The most common nerve injury due to false positioning is Option A. Median nerve. Option B. Brachial plexus nerve. Option C. Saphenous nerve. Option D. Femoral nerve. The correct answer is Option B. Brachial plexus nerve. Next question. In supine position, the maximum angle between the patient's body and his arm should not be more than Option A. 110 degrees. Option B. 60 degrees. Option C. 30 degrees. Option D. 90 degrees. The correct answer is Option D. 90 degrees. Next question. The scientific name of the vicryl suture is Option A. Polypropylene. Option B. Polygylcaprone 25. Option C. Polyglactin 910. Option D. Polyamide 6. The correct answer is Option C. Polyglactin 910. Vicryl is an absorbable, synthetic, usually braided suture manufactured by Ethicon. Thanks for watching. Like, share, subscribe and comment your valuable feedback.